Hello everyone. In this session, we are going to discuss about the inborn errors of metabolism. Are you aware of what is inborn errors of metabolism? Yes. It comprises of large class of genetic disease involving the disorders of metabolism. The majority of the defect is mostly due to single genes that codes for enzymes that facilitate conversion of various substances, which we call it as the substrate, into the others, that is the product. In most of the disorders, the problems arise due to the accumulation of substances which are toxic or interfere with normal function, or you can call it as the effects of reduced ability to synthesize the essential component. So, coming to the introductory part of the inborn errors of metabolism, they are always called as the congenital metabolic disorders or diseases, or otherwise we can coin them as inherited metabolic disorder. The major categories of inherited metabolic disorder would be disorders depending on the carbohydrate metabolism, amino acid metabolism, organic acid metabolism, fatty acid and pyrine metabolism, purine metabolism, steroid metabolism, mitochondrial metabolism, peroxosomal metabolism, and lysosomal metabolism. So here the introductory part of inborn errors of metabolism, it involves the genetic disorders which is involving the congenital abnormality or disorders of the enzyme activity. So more, as I told you earlier, it is either of single gene or either into the substrate or products. So here it is defined as either enzyminopathies. So some the book textbooks gives that as enzyminopathies, which is we will be knowing about the defect in the enzyme and which causes the end organ damage. Here are some of the list of inborn errors of metabolic disorders such as metabolism, carbohydrate metabolism, which is due to G6PD deficiency. And in amino acid, we'll be discussing about the phenylketonuria and maple syrup urine disease. And when we are discussing about the organic acid metabolism, I'll be teaching about the alkaptonuria. And when we are discussing about the fatty oxidation and mitochondrial metabolism, we'll be discussing about the glutaric acidemia. And when we are discussing about the pyranamide metabolism, we'll be discussing about the Leishman syndrome and so on. So coming to the G6PD deficiency, the major signs and symptoms is that the newborn or the neonate will be having jaundice. Here, hemolytic crisis might be there. That is illness, certain drugs, diabetic ketoacidosis, hemoglobinuria, and severe crisis of kidney injury. So this disease where the RBCs, which is carrying the G6PD enzyme, will be carried from the lung into the tissue through the body. But there is a defect in this enzyme which causes premature breakdown of the RBC, hence causing hemolysis. So the disorders of amino acid metabolism, here it is purely again another genetic disorder due to the PAH gene mutation which causes insufficient and non-functional of phenylalanine hydroxylase, which is the enzyme responsible for metabolism of excess phenylalanine. But this results in the buildup of dietary phenylalanine to potential toxic levels. So there we have to hear the child will be having certain symptoms of mental retardation, hyperpigmentation, some signs may throw up of seizure, skin changes, and so on. The next disease which we are going to discuss about the maple syrup urine disease. So the body cannot break down the part of the protein which we call it as the certain proteins such as leucine, then the methyltrexate, kexovate, kexocaprate. So these metabolism will be changing which causes the disease to develop the urine into the dark brown urine, or we call it as the maple syrup urine disease. So in this disorder, you can see the next disorder is that organic acid metabolism disorder, which we call it as alkaptonuria, which is an autosomal recessive disorder due to the defect of enzyme hematogenase 1 and 2 dioxygenase, which precipitates in the degradation of tyrosine as a result of toxic thyroxine byproduct which accumulates in the blood and it is being excreted in large amount of urine. So here mostly skin, heart, renal as well as the bones are being involved. So the babies when they have their nappies it is always blackish in color which shows that they are developing that particular disease. The treatment of alkaptonuria is that physical stress to the joints and spines to be avoided, symptomatic management, anti inflammatory medications can be given, or narcotics can be started to treat the joint pain if it is very severe. Physical therapy or occupational therapy to be given to strengthen the muscles and the joints and to prevent stiffness. In severe state, we can plan for surgical intervention, and high doses of vitamin C is given in order to stop the HGA accumulation. The next important metabolic disorder is that fatty oxidation, which we call it as glutaric acidemia. So here what happens is that the clients are having weakness, irritability, nausea, vomiting, hypoglycemia, that is sugar levels are very reduced, and acidosis, stopping breathing, that is cessation of breathing or might be apnea, seizures and coma. The major complication of this disorder is that the client can develop organ damage or learning disabilities. So the next is that we'll be discussing about the purine metabolism. So due to the purine metabolism defect, disease or syndrome which is characterized as Lysine-Nahan syndrome. The Lysine-Nahan syndrome is like the clinical features is like self-injury. Baby will be having dystonia, chorea, hypotonia, balismus, and developmental delay. It is mostly of X-linked recessive gene, which is HPRT1 gene, and that is defect in the purine metabolism. In laboratory findings, you can identify the disease by hyperuricemia. The disorders of steroid metabolism is that the client can develop congenital adrenal hyperplasia. When you see the picture on the left side, you can see that the adrenal gland is very much thickened and the growth of the adrenal gland is very high when compared to the lower kidney. The common symptoms is that not enough cortisol, excess androgen, atypical genitalia, then adrenal crisis, altered growth and fertility issues. So these clients can be easily elicited soon after birth by examining the genital area. The next is disorders of the steroid metabolism, which we call as congenital adrenal hyperplasia. So for these cases, we will be giving hydrocortisone is the treatment of choice according to the weight of the baby. We will be giving 10 to 15 milligrams per day, and hydrocortisone should be supplemented TID doses, and as usual the morning dose should be given as early as possible to enhance the function of the kidney. And stress doses of steroids can also be planned in case of stressful situations, and the other drug of choice is fluticasone, which is another hydrocortisone. So in case of emergencies, we have to maintain airway breathing circulation and IV access to be given. Isotonic solution, that is saline, can be started by 20 ml per kg over 10 minutes. And fluid resuscitation to be started according to the weight of the child and according to the hydration of the child. Do not hyperhydrate, that is overhydrate the child. Check the blood sugar level because there will be changes in the blood sugar level as well. Check the electrolyte levels, monitor vital signs and intake output chart and sensorium as well. The next disorder is mitochondrial function disorders, which we call as Keynes-AS syndrome. So this in short we call it as KSS, which is characterized by ophthalmologoparesis and pigmentary retinopathy before the age of 20 years. So you just see the picture. In the first picture, the child will be having one eye will be drooped down, eyelid, the other eye is very well open, and on the lower picture both the eyes are like sunset eyes. So in this it shows the drooping of the upper eyelid. So The patient can also have other disorders such as ataxia, cardiac block, raised cerebrospinal fluid, and this is caused mainly due to 5000 base deletion in the mitochondrial DNA, which is more than one genome can be placed in any cell at a given time. The treatment is that coenzyme Q10 can be administered and vitamin can be supplemented, insulin for diabetes mellitus, and as I told you, cardiac blocks can be there, pacemakers can be planned with a TPI or PPI, surgery to be done in case of visual problems such as ptosis can be corrected by some surgical intervention. So this is something we have to deal with all symptomatic management, not only going for a single therapeutic management. Then last would be lysosomal storage disorder, which is Gaucher's disease. The Gaucher's disease is a lysosomal disorder which we call it as LSD, which is caused by the fatty substances to build up in the body's organ and bone marrow. Gaucher's disease is caused by mutation in the GBA gene, which breaks up the enzyme glucocerebritase, which we call it as GCase. So, without enough GCase, fat builds up into the body in the macrophages, which are the immune cells, and they accumulate in the liver, spleen, and bone marrow, and causing the disease very, very high. So, in simple terms, you can tell that the child will be developing organ wise damages such as eyes, blood, bones, brain, lungs, and liver and spleen. In eyes, they are able to move the eye, yellow spots in the eye are seen, and when in blood, the child is going to be appear in anemia or thrombocytopenia. Bones, you can see that the client is complaining of joint pain and arthritis, osteoporosis, and osteonecrosis. And it comes to the central nervous system, difficulty in coordination and motor skills. And when you take about the lung, breathing difficulty, and in the liver, enlargement of the liver and spleen. There is no specific treatment for Gaucher's disease. Only symptomatic treatment can be given. Enzyme replacement therapy. The common enzyme which is replaced is glucocerebritase enzyme with artificial enzymes, and it is given in infusion every 2 weeks. Substrate reduction therapy, that is reduce the glucocerebroside level in the blood, and osteoporosis drugs can be given to strengthen and rebuild the bones and tissues. The other drug of choice is that miglustat, eglustat, that interfere the production of fatty chemicals and inhibit more production of them. Removal of spleen in case of severe state may be necessary. To conclude or to summarize, inborn errors of metabolism are large class of genetic disease involving disorders of metabolism. The majority are due to the defects of single gene or might be multiple gene. Most of the disorders are the problems due to the accumulation of the substances which are toxic and which interferes with the normal function, which causes reduced ability to synthesize essential components. To conclude the topic, I would state that here the inborn errors of metabolism, there are many more errors of metabolism. Like for example, when you take the what do you say about the metabolism of pyruphane metabolism, acute intermediate pyruphia, or might be due to carbohydrate metabolism, glycogen storage disease. So like that you have n number of this inborn errors of metabolism, but here in this video I have just given the gist of what are the major inborn errors and how it is being screened and how it can be treated. To conclude, inborn errors of metabolism is like it's comprising large class of genetic disease involving the disorders of metabolism. So in this, I think you would have come across how you can define inborn errors of metabolism, list out the possible types of errors of metabolism enumerated, and you can also explain what are the signs and symptoms of Gaucher's disease, and in case what is KSS. You'll be able to explain what is KSS as well. So followed by that, I would have given the common references. So you can go through the references to find out in-depth knowledge of what are the major changes of the inborn errors of metabolism and how it can be screened and how it can be. Mostly all these disorders of genetic, which is you can get an idea that it is only purely due to the genetic defect, and only symptomatic treatment can be given, and we can prevent the further deterioration. We cannot go in for a curative therapy, but in case if you find it earlier, might be in fetal period, there can be some corrections, so you can plan in for some counseling therapy, and then we can delay that particular disorder to begin in that particular individual. So thank you so much for your patient listening. If you have any doubts or any suggestions to be given onto this particular video, please put it onto the comments box. Let me go through it and get back to you. Thank you all. Thank you so much. Thank you for your patience.